Hi everyone, this is the Community Health Nurse with the Yukon Immunization Program. In this short video, I will talk about why it is important to keep your children up to date with their immunizations during COVID-19 and the consequences of delaying. I will also discuss the safety measures that are and can be taken to help patients feel safe when attending their appointments. As most of us know by now, these are the recommendations put forth by the Chief Medical Officer of Health in the Yukon. The goal is to keep people healthy by decreasing the spread of COVID-19 as much as possible. Because there are things we still need to do in life, such as buy groceries to feed our families, the recommendations are to do the best we can in limiting our exposure to others. With the same goal in mind of keeping people healthy and decreasing the spread of illness, children's routine immunizations must be maintained during this pandemic. A few of the diseases we vaccinate against are measles, chickenpox, pneumonia, and whooping cough. Diseases such as chickenpox may not seem serious because they used to be so common. However, it's important to realize that the complications of these diseases can be deadly, especially when they spread to high-risk clients such as the elderly or immunocompromised. The best way to prevent getting or spreading these diseases is through immunizing. Immunizations have saved more lives in Canada than any other medical intervention in the past 50 years. The children's routine immunization schedule was and still is a public health priority. Immunizations successfully prevent many serious childhood infections, many of which we do not see today because we immunize on a set schedule. Immunizations protect our children and our families, and in doing so protect the greater community. These diseases do still exist, and they will return if we stop or delay immunizing. When there are decreased immunization rates in a population, there is an increased risk of vaccine-preventable diseases. This enables outbreaks, one example being a pertussis outbreak, also known as whooping cough, in NWT last January. As we have seen with the spread of COVID-19, viruses can spread quickly. A disease such as the measles is highly contagious and would spread quickly if the immunization rates were to decrease. Immunizing children and on time is the best way to ensure we do not see a spread of any of these diseases. This is our Yukon Children's Immunization Schedule. Certain vaccines are given at certain ages based on the biological development of a child's immune system. This is why it is important to stay as close to the schedule as possible. On a routine basis, you can expect your child to receive between 1 and 4 vaccines at a time, and during the ages of 2, 4, 6, 12, and 18 months, and then during school entry, grade 6, and grade 9. Influenza vaccines start at 6 months of age and are given on a yearly basis. So why is this extra important during the COVID-19 pandemic? Immunizations help arm us in the fight against specific diseases. When our immune systems are strengthened against many diseases, it is healthier overall. It decreases our chances of not only catching the vaccine-preventable diseases, but other potential secondary complications of these diseases. Strong immune systems will also help keep our children and families out of hospitals during this pandemic. There are many people that cannot get vaccinated with certain vaccines. They include individuals who are immunocompromised, pregnant, or under the age of 2 months old. When the people who can get vaccinated do so, it lessens the chances of vaccine-preventable diseases spreading around. This in turn protects those who cannot get the vaccines and is also known as community immunity. Due to the strained healthcare system and the isolation measures of COVID-19, there are many non-essential medical treatments being deferred, examples being dentistry and non-emergent x-rays. The Children's Immunization Program is not one of these, and for good reason. If we delay routine immunizations, we are making the whole community more susceptible to catching vaccine-preventable diseases once the isolation measures stop. As physical distancing measures become less strict and borders reopen, we will quickly be introducing the potential spread of disease. By making sure children and families are already up to date with their immunizations, the whole population will be at less risk of catching any of these diseases. When we don't have to play catch-up on immunizations, we avoid future outbreaks, hospitalizations, and deaths. So yes, physical distancing is important, but so are immunizations. Immunizations are essential in protecting our children and population as a whole. The government is working hard to protect the public within each healthcare facility. There are extra cleaning measures at all times and with signage to ensure everyone is educated on the appropriate physical distancing measures. Staff are being monitored for any potential illness and sent home if sick. Appointments are spaced appropriately to help decrease unhealthy and healthy people being seen together at the same time. In facilities with walk-ins, appointments are being encouraged. Within each facility, the waiting rooms are rearranged to ensure there are enough spaces between everyone. There are screening measures in place to make sure people with symptoms are not attending the public areas as appropriate. Nurses who provide school immunizations or large catch-up programs will not be doing that for the time being. And lastly, we are encouraging that all children's routine immunizations continue to be administered. Along with the measures that we are taking to protect the public, there are a couple measures you can take to protect your own family. If you are unsure if your child is due for any vaccines, call your local healthcare provider to ask. This would be the health centers in the Yukon communities or the Whitehorse Health Center if you live in Whitehorse. If they are up to date, great, no need to come in. If they are not, an appointment can be booked. This is the first step towards having full protection against vaccine-preventable diseases. When attending immunization appointments, physical distancing of 6 feet is very important. Quick tip, 6 feet is approximately the length of 2 huskies or 8 sourdough loaves of bread. We realize that childcare is important and that sometimes the whole family may need to attend an appointment. We ask that you try to limit the amount of people who attend each appointment, such as just one parent and just the child getting immunized. This limits the exposure of your family to the public and also decreases the potential spread of COVID-19. As you know, proper hand washing is the best way to prevent the spread of COVID. Remember, COVID, along with most viral illnesses, are spread by droplets from the cough or sneeze of an infected person. If you properly wash your hands prior to touching your eyes, nose, or face, you greatly decrease your chances of catching any illness. Another quick tip. 20 seconds can seem like a long time, but if you sing the ABCs or the Happy Birthday song twice, it is much more accurate. Washing with soap and water is the best way to clean your hands, but should these not be available, hand sanitizer is the next best method. Prior to COVID-19, mild cough and cold type symptoms were not a reason to delay getting vaccinated. However, during these isolation measures, we are asking people not to come in if they have any of these symptoms to help decrease the spread of any type of viral illness. It is important that you reschedule your child's vaccine appointment once they are well to ensure it does not get forgotten. Lastly, educate yourself and others on the importance of immunizations. It benefits you when those around you are up to date with their immunizations, as there is less of a risk of catching any vaccine-preventable disease. It is important to know both the risks of going in for your vaccine appointment along with not going to your vaccine appointment. Credible resources are essential when making an informed decision. Here is a list of a few credible resources that the Yukon Immunization Program recommends for both immunizations and COVID-19 related information. Either speak with your local healthcare provider or visit yukonimmunization.ca, yukon.ca/COVID-19, the Government of Canada Public Health website, or the Centers for Disease Control and Prevention website. The bottom line, there is a very low risk of catching COVID-19 when out in public, but there will be a higher risk of catching many more diseases if we delay vaccinating. If you have any questions, please contact your local healthcare provider. Thanks for listening.